Well, you know, instant gratification is our way of life. We want everything fast and we want it easy. Now women who want to enhance their bodies can go under the knife in the morning and be back home by dinner. But is it safe? Health and wellness reporter Sonia Azad takes a look in this WFAA original.
Time. It's our most precious resource. We're rushed for time, waste time, lose track of time, and race against time.
Definitely never a dull moment.
Stacey Grote-LeMay works full-time as a nurse.
Being a nurse, I'm a hard patient. I have very high standards, and I have a lot of questions.
So when she decided it was time for a breast augmentation,
the recovery time is the thing that's always scared me.
She wanted the fastest turnaround time possible.
Our patients typically will go back to work the day after, as long as it fits your breast pocket.
Dr. Farah Khan is a cosmetic surgeon in Dallas.
The majority of our patients, 15 minutes after surgery, are able to fully extend their arms.
She's one of a handful of plastic surgeons in the city who offers 24-hour recovery breast augmentation.
They can come in on a Friday, we can operate on them. Typically that night, they're out shopping, they're out to dinner. The next day, they can go back to work.
What about the bandages, the pain meds, the recovery time?
Ain't nobody got time for that.
This is almost routinely done as an outpatient procedure.
So you can come in the morning, leave in the afternoon.
That is correct. The breast augmentation procedure takes about 1 to 2 hours, and the patients can leave the same day.
Times sure have changed. UT Southwestern's Dr. Bardia Amirlak told us 3 factors have helped to speed up their process: advanced technology, modern surgical techniques, and better recovery methods when it comes to anesthesia.
We do a precise dissection the day of surgery. We don't tear the tissues. We don't cause a lot of inflammation, a lot of trauma to the tissues.
I arrived at the center at 7, was home by 9:30, and was out shopping and eating at 4 o'clock in the afternoon.
But wait.
Not so fast.
One has to be careful not to push too much. I think that anything that raises your blood pressure over normal after the augmentation surgery may potentially be harmful.
It's time for the fine print. Ideal patients are young, healthy, and want relatively small implants. Going too big or too complicated requires more downtime. After the surgery, no driving under anesthesia, no exercising or heavy lifting for 2 weeks, no swimming or hot tubs for 6 weeks. Risks include excessive bleeding and infection.
I was only off work for 3 days.
Months after her successful procedure with only a small scar, Stacey says her experience was worth the time. Sonia Azad.
Thank you for your time.
Channel 8 News.
So the cost of the surgery can vary depending on what type and size of implant you get. To learn more, click on Sonia's story on WFAA.com.